advocates who are working with immigrant families in Massachusetts. This is sponsored by the Massachusetts Access to Justice Commission. My name is Katie Lambing. I'm an immigration lawyer at the Rion Immigrant Center, formerly Irish. And my co-moderator today is Katie Perry-Lorenz from the Children's Law Center of Massachusetts. We are really excited that you're here today to get this information to support these families as best we can during this really weird and scary time. I'm going to start by introducing the panelists that you'll hear from today just really briefly. So presenting today, we have Emily Lung from the Justice Center of Southeast Massachusetts, Catherine Condon-Grace from Metro West Legal Services, Pablo Carrasco from Justice at Work, and Jill O'Brien from the Justice Center of Southeast Massachusetts. I also want to give a shout out to Rochelle Hahn from MLRI and Jen Howard of Rosie's Place, who are both here and in the background and monitoring questions and giving us support while we do this. So now that you know who we'll be hearing from today, I have just a couple of initial matters to address. The first thing that you should know, I said this already, but some of you weren't here yet, this is being recorded, so it'll be accessible online afterwards, but that also means that the chat is being recorded as well, so everything that you're putting in now and all of the questions that you input will be visible forever. The second thing is that this training was designed primarily for non-lawyer community advocates, and we're happy that so many lawyers signed up and are here today, but this is going to be primarily sort of a big picture presentation with information about eligibility for some of these programs, and not a step-by-step guide to how to apply for them or what to do if somebody gets denied or is told that they're not eligible. The third thing is that we have a lot of questions already because you were all given the chance to submit them when you signed up. We are going to try to get to everything that we can. You can keep submitting questions in chat and we'll be monitoring those. We're going to save answering those until the end because a lot of the presenters have tried to answer as many questions as they can and put that into their presentations. The couple things that you should know about that is that you are all going to stay muted, so please put your questions in the chat instead of saying them out loud. And the last thing is that we won't be answering specific case questions today. There's just not enough time, and often in a situation like this, we're not able to get enough information. So we are going to provide a list of legal services providers that are doing consultations and open for intake right now. So if you have specific case questions, you can reach out to any of those organizations after this is over. And with that, I'm going to pass things over to Emily to get the presentation started.
Thanks so much, Katie. Thanks to the Access to Justice Commission and for everyone for joining us this morning in everyone's fun favorite format to do everything now, which is Zoom or Teams or some version of this GoToWebinar. And so now everything in my life happens in tiny square video boxes, and this is no exception. So thanks so much. And I really appreciate Katie sort of setting the stage because I don't want everyone to be disappointed that you're not going to walk away with answers for every client that you work with and their situation, as well as being able to fill out unemployment and know how to do all these Masshealth applications. We're really here to do a pretty broad overview about things that we see are impacting the immigrant community and sort of the unique considerations for the immigrant community. But each of the topics we're going to touch on could honestly be their own half-day training. And there will be a future training on immigrants and benefits coming, which I'll let Katie talk about that since she is one of the presenters for that. So with that, I'm just going to start with a few updates on immigration and sort of what's happening with the offices of immigration themselves. So USCIS, which is the U.S. Citizenship and Immigration Services offices in Massachusetts, those are the offices in Boston and in Lawrence, where folks go for their interviews, for all types of applications. Those appointments have been suspended through June 3rd at the moment. And that means anyone who had appointments scheduled with immigration from back in March through June 3rd, those are going to be automatically rescheduled. We don't have an announcement as of yet in terms of what will happen after June 3rd. There's been some indication that they're hoping to reopen or do some amount of reopening in some offices nationwide, but we're just waiting for more guidance. But as of now, that's the information we have. There is a very, very, very limited availability for some emergency situations. Unfortunately, the client situation that your client is in is probably not an emergency situation that's going to qualify for in-person services. On the other hand, immigration is still processing applications every day. They're still accepting applications online and through the mail. They're still processing that. We are still receiving receipt notices for things that have been filed. We're still receiving communication from immigration. So things are still moving forward. There has been some limited flexibility that has been instituted. So for example, they relaxed the rules on sort of quote unquote wet signatures, meaning original signatures. So they're accepting copy of signatures. We have seen they're accepting some copies of documents that they would not have in the past. They've issued some limited extensions on some deadlines, but those are really only for cases that were already pending, where they were requesting more information or where there was a denial and someone was requesting an appeal. So if there are other deadlines in place for someone, they're going to age out, meaning that they're not going to be eligible because of their age or other things like that. There has not been any blanket extensions in immigration in terms of what's happening with filings. In the court system, we have also had all of the non-detained cases, meaning everyone who's not in immigration detention. Their cases have also been rescheduled through May 29th. May 29th is a Friday, so that means presumably that if they were going to restart those cases, they would be on Monday, June 1st. Detained cases for folks who are in detention centers are still going forward. Telephonic appearance is an option for advocates. Obviously, individuals who are in detention are just subject to, unfortunately, the rules of the detention centers. And then they have established a temporary email filing system for the immigration court, which they've never had in the past. And so that is also available for filing. And then ICE check-ins, which are check-ins that folks have to do with Immigration Customs Enforcement. That's what folks normally known as their appointments in Burlington, Massachusetts. Those appointments have been switched to telephonic appointments. We've heard from a lot of folks that they're not able to get through, and what ICE has communicated is that people just need to keep calling. They don't need to show up. Even if they aren't able to get through on the day of their appointment, they should leave a message or they should continue to call until they're able to get through to someone. But they haven't announced a time frame for when that suspension of in-person check-ins will be discontinued. But for now, those check-ins are not happening in person, and folks should just call. That's very frustrating, I understand that, but that's sort of the system at the moment. So folks should call and continue to call if they don't reach someone, or leave a message if they don't hear back from someone. So those are kind of just the overall, that's what's happening with immigration. So some things are still moving forward in terms of with immigration petitions, but all the appointments unfortunately have sort of been canceled. That includes fingerprinting, that includes naturalization oath ceremonies, this includes asylum. All of the appointments with immigration that are in person have been temporarily suspended. So that is sort of the overall update of what's happening with immigration. And so if there's any questions, please put those in the chat and we'll get to those. But we're gonna move now into sort of the benefits world, and Katie's gonna kick it off with a bunch of great information about Masshealth and SNAP and everything that's happening in that world.
Thanks, Emily. For those of you listening, I just wanted to let you know a little bit more about Emily Lung, our last presenter that we'll be hearing from again later in this presentation. Emily is the supervising attorney of the Immigration Unit at the Justice Center of Southeast Massachusetts. And the Immigration Unit focuses on providing representation in a wide range of family-based and humanitarian immigration cases and removal defense. Emily also participates in local, statewide, and national advocacy, as well as community education and outreach. So thank you very much. We're now turning to our third Katie of the presentation, Catherine or Katie Condon-Grace. And Katie is a staff attorney at Metro West Legal Services, where she runs the medical legal partnership between Metro West Legal Services and the Edward M. Kennedy Community Health Center in Framingham. She works together with healthcare professionals to help identify their patients' health harming legal needs, and she provides direct case representation to patients in the areas of immigration, family law, housing, and public benefits. So Katie's going to speak to us now about some changes to Masshealth, SNAP, and PEBT during COVID-19.
Okay, thanks, Katie. As she said, I am also Katie. I'm Katie Condon Grace. So right now, I'm going to be talking about some of the changes that have happened with Masshealth and other health benefits in response to COVID-19 and how those more specifically affect our immigrant community. So first and foremost, I want everyone to know that immigrants are eligible for health insurance, even undocumented immigrants, whether it's through Masshealth, through the Massachusetts Health Connector, the Health Safety Net. Everyone, regardless of immigration status, is eligible for some form of health benefit, depending on a number of factors like age, income, disability, or your particular immigration status. And someone may only be eligible for Masshealth Limited, they may only be eligible for safety net benefits through the Health Safety Net, or they may be eligible for more comprehensive benefits through Masshealth, like Masshealth Standard or Masshealth Assistance. And some immigrants may even qualify to purchase a plan through the Massachusetts Health Connector or a Connector Care Plan. Again, as Emily and Katie previously said, explaining immigrant eligibility for health benefits is a training in and of itself. And we actually will be having that training remotely via Zoom in June about immigrant eligibility for public benefits. So if you all would like a more in-depth analysis of all of these different areas, we would encourage you to sign up for that MCLE training in June. That information should be coming out in the next couple weeks. So right now, again, as I said, immigrants are eligible for some form of health benefit coverage in Massachusetts, so we would encourage everyone to apply. And so right now, what I'm going to talk about are kind of the updates to be aware of with Masshealth, the Health Connector, and Health Safety Net that have come about in response to COVID-19. So one of the first things that they have done is Masshealth has made the application process easier. They've allowed applicants or authorized representatives to verify eligibility factors through self-attestation. Usually you used to have to submit proof to Masshealth in order to get coverage, proof of income, proof of assets, whether that be bank statements or pay stubs. Right now, Masshealth, because they realize it's very difficult for people to get this information and submit it, they're allowing you to do a self-attestation. They have a form that you can get off their website and fill out and submit to Masshealth. The easier way that we found for people to do this is actually to call the customer service hotline and speak to a Masshealth representative, and they actually will do the form with you over the phone and sign it on your behalf. If you're self-attesting to disability, that's something that members can also self-attest to. You need to call the Disability Evaluation Services as opposed to the Masshealth hotline. And they've also made it easier because now certified enrollment assisters are actually able to sign for clients. So when they're doing applications for clients or patients, the certified enrollment assister can actually make that signature for the client when they submit the documentation, so the client doesn't actually have to sign those documents. Masshealth has also made changes to allow more people, including immigrants, to qualify for Masshealth coverage, and they've made ways to ensure that people keep their coverage during the pandemic. So the Health Connector itself now has a special enrollment period that's open until May 25th. So for people who don't have a qualifying event that allows them to sign up for healthcare through the Health Connector, they can do that through open enrollment until May 25th. If people lose their jobs and lose any insurance that they get through their jobs, that's a qualifying event that they can sign up on for the Health Connector. One thing that is really very important to understand is that for Masshealth, during the national emergency, there can be no new restrictions on Masshealth eligibility rules or increases in premium rates during the national emergency. Additionally, Masshealth has made some changes. They have a new hardship waiver for Masshealth deductibles. So there are certain people who don't qualify for Masshealth until they've met a deductible amount, until they've incurred costs up to a certain amount. Now, these individuals can be eligible to obtain coverage if they submit a waiver of the deductible on a grounds of financial hardship. And this includes immigrants. So in cases of financial hardship, it waives this deductible requirement for people who aren't eligible for coverage until they meet that deductible. So they're eligible for the coverage right away. There's a deductible waiver application form available through Masshealth that individuals can submit to Masshealth to waive For the health safety net, some individuals, particularly immigrants, may have health safety net partial, where they have a high deductible that they need to pay down before their health safety net coverage will actually kick in. During the national emergency, or excuse me, during the state of emergency, health safety net partial clients and patients don't need to make payments towards that deductible. So their coverage, their health safety net coverage will cover things, and they don't need to make that deductible. Health safety net will pay the cost of services. Masshealth is also now going to be more flexible on granting premium waivers based on hardship. So some individuals can't get coverage because they have past due premiums and they can't get coverage until they pay those premiums going forward. Masshealth is now giving more flexibility in waiving those premium requirements. So what this does is it waives past due premiums for people who are ineligible for coverage until they pay those. So again, they're eligible for coverage right away. And another important thing to note is that applicants for hardship, they can fill out the application or just call the customer service hotline. A lot of these applications are available, but a lot can be done also with calling the customer service hotline. I know that can be an incredibly frustrating experience. Sometimes they will hang up on you. I would say it's better to call earlier in the day, but that is an efficient way to get things done because the certified application assistant can sign documents on clients' behalf and get them right into the system. So the Health Connector also has its existing hardship policy for premium waivers. That hasn't gotten more broad, but it still exists. And so another thing they've taken into account is the $600 additional unemployment per week. I'm not going to talk about unemployment benefits, but I just want folks to know that for purposes of Masshealth and Health Safety Net, the $600 additional unemployment that some immigrant clients may be eligible for, a lot won't, is not counted as income for Masshealth. It's not counted as income for Health Safety Net, but it is counted as income for any plan through the Health Connector. And if any immigrants are eligible for the stimulus, again, we'll talk about that later, many are not, that stimulus does not count as income, and it doesn't count as assets for 12 months for Masshealth, Health Safety Net, or the Health Connector. Another really important protection that Masshealth and Health Safety Net and Health Connector have put into place are protections from losing coverage. We want people to keep coverage and get medical care throughout this emergency. So for Masshealth and Health Safety Net members, as of March 18th, if they have coverage, they will not lose coverage or have any decrease in benefits for any reason except for moving out of state or death. So for any reason except for moving out of state or death, Masshealth cannot terminate someone's coverage or decrease any of their benefits during this period. People may be still receiving notices from Masshealth. There have been some issues where notices were still sent out. That coverage cannot be terminated during the emergency. And during the Health Connector, or for the Health Connector during the emergency, they're not going to downgrade anyone for failure to respond to requests for information. And additionally, another way to help people keep their coverage or prevent from losing their coverage for the appeal process, that used to be 30 days after a decision, it's now 120 days, and hearings are going to be telephonic. Masshealth has also improved access to benefit services. Masshealth is covering telehealth, and that includes Masshealth Limited and Health Safety Net. Masshealth and Health Safety Net members can get 90-day supplies of most prescriptions. PCA rules for those who are eligible are now changing to allow for more services and prevent gaps in services. And Children's Behavioral Health Initiative assessments can be done telephonically now. Something that's really important to keep in mind has been the coverage for COVID-19 testing and treatment, because we really want to encourage individuals who are sick or exposed to get tested. So Masshealth and all plans offered through the Health Connector, so this includes Masshealth Limited, cover all testing, treatment, and prevention when it's available for COVID-19 with no cost sharing. So it's very important for our immigrant clients who have Masshealth Limited. That covers all testing, all treatment for COVID-19. The Health Safety Net had initially stated back that they were covering all testing and treatment for COVID-19 with no cost sharing. They still have a way to do that, but additionally, there's also the federal program for the uninsured. So this includes individuals who have no health insurance. It's regardless of immigration status and regardless of income. The federal program for the uninsured covers the cost of COVID-19 testing and treatment with no cost sharing. There's no limits based on state residency, immigration status, or income. So this is how individuals can get tested. So I've done a lot of talking about the changes to Masshealth and the things that are available for our immigrant community. A really large concern that our immigrant community has with Masshealth is public charge and health coverage. And what does this mean for my immigration status going forward with this overall public charge rule that is still in effect right now? So USCIS, which is the United States Citizenship and Immigration Services, they're the administrative body that processes a lot of these applications. They have explicitly put on their website, which is pretty rare, that COVID-19 testing and treatment will not be considered in the public charge test. That's really important that we reiterate that to our immigrant community members, that any testing or treatment that they receive will not be counted in the public charge test. One thing that I just want to reiterate for people, just for Masshealth generally, the public charge test does consider health benefits, federal health benefits, but there are certain benefits that are not counted in the public charge test. And that includes emergency Medicaid, which is Masshealth Limited, and our health safety net. A lot of our immigrant clients, those are the only health benefits that they're eligible for, Masshealth Limited and health safety net. Those are not counted in the public charge analysis. And any health benefits received by a person under 21 years old, those are not counted in the public charge analysis. And any health benefits received by a pregnant woman, including 60 days postpartum, are not counted in the public charge analysis. So we really want to make sure that our immigrant clients know that for a lot of them, the health coverage they're eligible for is not considered in the public charge test, and they may be exempt from the public charge test. For example, there's a whole group of category of immigrants who are exempt from the public charge test in the first place, asylees, refugees, and people with other sorts of humanitarian status. So we want to keep that in mind. So now I'm going to switch gears a little bit. I know that was very fast and not as thorough as some individuals would like, but we're pressed for time here today. So I'm going to move on to SNAP, which is food stamps. And again, SNAP eligibility for immigrants is a training in its own right. So I'm just going to do a broad overview today. But generally, SNAP eligibility for food stamps is limited to low-income U.S. citizens and qualified legally present immigrants. And qualified is its own term and definition. Qualified immigrants are immigrants like lawful permanent residents, refugees, asylees, trafficking victims, and certain battered immigrants. Some lawful permanent residents, green card holders, have to have had their green card for 5 years before they can get SNAP, unless they have a child under 18 or a disability or work history, or they had an earlier humanitarian status like refugee status or asylee status. So there are only certain categories of immigrants that are eligible for SNAP, and it's actually more limited. So SNAP is not available to immigrants who have TPS, DACA, U visa, or non-immigrants like students or visitors. So a lot of immigrants are not eligible for SNAP. But it's important to keep in mind that if you have an ineligible immigrant adult and they have eligible household members, that immigrant may be able to get SNAP benefits for those household members. For example, if you have two parents who are both on TPS and they have 3 U.S. citizen children, those parents can apply for SNAP benefits for their U.S. citizen children. The benefits will be for that child. The SNAP card will likely be in the parent's name because they'll be the one making the purchases. And sometimes immigrant parents get concerned with that because they see the SNAP card and see that the benefits are in their name. What's important to understand is those benefits are for the eligible children, even though the card's in your name. So any SNAP benefits received by those eligible family members are not going to affect the immigration status of the ineligible family members. It's not counted in the public charge analysis. So that's something that's really important to keep in mind. And again, a lot of immigrants who are eligible to receive SNAP are actually exempt from the public charge rule anyway. So SNAP is one of those things where a lot of immigrants are not eligible for it, even though it does count as a public charge. And generally those immigrants who are eligible for it are either exempt from the public charge or already have their green card and have had it for 5 years and the public charge test doesn't apply. So in addition to the SNAP benefits, so DTA is issuing emergencies, supplemental SNAP benefits to a lot of SNAP households to help them buy food during the pandemic crisis. What's important for everyone to understand is this is not going out to everyone. This is going out to SNAP households who are not currently receiving their maximum monthly benefit based on income. So for example, if a family is not receiving the maximum monthly benefit, they will receive a supplement amount from SNAP added to their EBT card to bring them up to the maximum monthly benefit for that household. If a family is already getting the maximum monthly amount, then they're not going to get the SNAP supplement. So the SNAP supplement is only going to families already receiving SNAP who are not receiving the maximum benefit amount for their household. And these eligible households are going to get extra SNAP payments on their EBT card each month until the public emergency ends. So again, we're encouraging low-income eligible immigrants not receiving SNAP to apply for SNAP. And again, if they're found eligible for SNAP, and if they aren't receiving the maximum household amount, they'll be eligible for the supplemental SNAP to bring that up to that amount. And again, as with public charge, most immigrants who are eligible for SNAP are not subject to the public charge rule or are exempt for it. So it's a case-by-case analysis with each immigrant of whether or not SNAP would be a public charge issue for them. But most immigrants who are eligible for SNAP and the supplemental SNAP are either exempt or not subject to the public charge rule. So then moving on from SNAP, there's a new program that's independent from SNAP, and it's called the Pandemic Ebt Program. We call it the PEBT program. And what this does is the PEBT program provides additional food support to students who received free or reduced price meals under the National School Lunch Program. And they would be receiving those, but for the fact that the schools closed due to COVID-19. The PEBT is its own program. It's not SNAP. It's confusing because it functions like SNAP, where dollars are put onto an EBT card. So that can be confusing for some people. They think it's SNAP. So these PEBT benefits are available to households with students who receive free or reduced price school meals under the National School Lunch Program, regardless of immigration status. And it is not considered a public charge. Whereas SNAP is considered in the public charge analysis, PEBT is not considered in the public charge analysis. DTA confirmed to our SNAP coalition that the USDA told DTA that Pandemic EBT is not considered under a public charge. So we do have confirmation of that from a federal administration. So for families who are already receiving DTA benefits, whether that be TA, FDC, or SNAP, they're going to get their PEBT benefits on their existing card or on a separate card in their child's name, depending on how old their child is. For families who are not currently receiving DTA benefits, but their child is receiving free or reduced price school meals, they're going to be mailed a new EBT card in the child's name. And again, if the EBT card comes in the child's name, the parents can use it. For example, a young child might get a PEBT card in their name. That child is not expected to go to the store and go shopping. Mom can go to the store and go shopping with that card, and the store should not be scrutinizing EBT cards or PEBT cards. So that's something the parents should not be worried about, and we've heard that stores haven't been giving parents problems with this. So for parents who are not currently receiving, or for families who are not currently receiving DTA benefits and whose child is not getting free or reduced price school meals, what we would encourage people to do is to reach out to DTA directly to apply for SNAP, to contact the National School Lunch Program to apply for that program, or to contact the Project Bread hotline. Those are really good resources for immigrants in order to get access to these benefits. And again, just really want to reiterate that using the PEBT benefits does not impact your child or any other family member's immigration status because the public charge rule doesn't apply to these benefits. And that is all I have on those areas. We're going to move along.
Great, Katie, thank you very much. I had a question come in on the chat that I just wanted to ask you for clarification.
Sure.
The question was, I think in regards to Masshealth, are protections tied to federal emergency declarations or state declarations?
It depends on the declaration, because Masshealth is a mixture of state and federal. So it really depends on, particularly for if it's through the health safety net, the health connector, or through Masshealth. They either vary from the state of emergency or the national emergency. And there is a chart that MLRI has put out that I believe is attached to the resources that really clearly states the policy, where it's from, and the timeline of the duration. Most of the duration of these policies are either through the state of emergency or the national emergency.
Great, thank you so much. And I'm sure we'll have more questions for you at the end.
No problem.
Now we're going to go back to Emily, who's going to talk about some housing related developments under COVID-19.
Thanks so much. I'm going to keep this housing section pretty brief because there is an entire housing Q&A that happened a couple of weeks ago, and I'm going to ask one of our moderators to put the link for the housing training that happened similar to this one in the chat so folks can see that as well. But just so everybody knows, in the housing front, there was an eviction moratorium that was instituted on a statewide level, which has declared that there will be no evictions through either August 18th or 45 days after the expiration of the governor's emergency order, whichever is sooner. And so what that means is that there should be no evictions happening in the state unless they are directly connected to criminal activity or public safety problems. And so it doesn't matter if someone's eviction process had already started prior to the declaration of the eviction moratorium. Those cases remain on pause. No tenant should be receiving eviction notices of any type from their landlord. That doesn't mean that rent will not be owed. Rent will still be owed during this period and after the moratorium expires, but no one should be receiving eviction notices and no one should be evicted during this time. If anyone is receiving notices or if they're being told by their landlords that they're being evicted or getting notifications, they should certainly contact legal services to let them know about that. The housing advocates are closely monitoring this situation throughout the state. Of course, the housing eviction moratorium applies to all residents in Massachusetts. Immigration status has no impact on people's rights under the eviction moratorium. And tenants should certainly be reporting to legal services or the Attorney General's office if immigration status is somehow also being implicated in the threats of eviction. So again, rent will still be owed during this period, so it's important that as much as possible, people try to save money for rent if they're able to, but of course, if they need to meet more immediate needs, healthcare, food, then they need to do that. There should also not be late penalties charged if the reason why a person is not able to pay their rent on time is because of COVID-related concerns. Folks do need to notify their landlord in writing that they're not able to pay their rent due to financial impacts of COVID-19. And that doesn't, again, excuse them from paying their rent, but it means that there won't be additional fees tacked on to the late payment of their rent when they are able to make those payments. So it's just really important that folks know that. We know that in all of the communities that we work in, a lot of times people don't understand what their rights are under the housing laws. In Massachusetts, residents cannot be evicted from their housing until a judge orders that eviction and it is executed. So people should not leave just because their landlord says so. This also applies to folks who are in what I would say are non-traditional housing arrangements, which is very common within the immigrant community. So if someone's living in sort of like a rooming house, they don't have a lease that's written down, they're living with multiple people, but they are paying someone monthly or weekly or whatever it is for their housing, eviction protection still applies to them, even if they don't have a traditional sort of lease agreement or a traditional landlord. I also just wanted to note that there is some state-based assistance available through the RAFT program, which is the Residential Assistance for Families and Transition program. That is a fully funded state program, which means that all individuals, regardless of immigration status, are eligible to apply for RAFT if they meet the other eligibility requirements of RAFT, which have income and other requirements. And because it's a state-based benefit, that would not be considered for public charge if they were to receive RAFT assistance to help them to pay for their rent or utilities. That would not be counted under public charge. There is unfortunately not a lot of RAFT assistance available, but the applications are relatively easy to do in the scale of applications that need to be done. And so we do encourage all families who need that type of assistance to consider contacting one of the local agencies that assist with RAFT, because it is an option that exists. It's available for all families, no matter immigration status, and it doesn't count for public charge. So all of those are really beneficial options. And then at the end, Jill will also be just talking about a lot of resources that might be available to folks who don't qualify for any types of benefits. And a lot of the funds are helping people with sort of food, rental assistance, healthcare needs, those kinds of things. So that's just a little bit on housing. And again, there's a whole training on housing, and Mass Legal Health has a lot of information about housing as well, which Jill will talk about as well. So that's just so folks know about that. And I'm going to turn over to Katie, who will turn it over to Pablo so we can learn more about unemployment and workers' rights.
Thanks, Emily. I'd just briefly like to introduce our next presenter, Pablo Carrasco. Pablo is a staff attorney at Justice at Work. For those of you that don't know, Justice at Work's mission is to provide strategic legal support for low-wage worker organizations and their members to strengthen organizing. Justice at Work provides worker center partners and the people they serve with legal services, training, and legal counsel for collective action. They specialize in workplace rights. And so now we'll hear from Pablo, who's going to highlight some key rights available to workers generally and in light of the current situation.
Thank you so much, Katie. But before I start, I just wanted to mention what worker centers are. So worker centers are community-based organizations that provide, among many things, organizing support for low-wage workers. Worker centers are usually the only support, friend, allies that immigrant workers have, especially recent arrivals. Worker centers create opportunity and connect workers with resources. If you're trying to help an immigrant worker, make sure you're familiar with the worker centers in your area. I simply just cannot stress that enough. We provided a list of local worker centers in Massachusetts, and please note it's not an exhaustive list, but it's a good list to start with. So I'm going to start talking about the benefits that are available to workers who are out of work, and then I'm going to address some of the benefits available for essential workers that are making life possible for all of us. Please note this is going to be a macro view of the law. We simply just don't have time to get into the weeds, but I'll try to get you the important details. So right now we'll start talking about unemployment compensation. A lot of people are out of work due to COVID-19. Unemployment is the very best way to maintain steady income during the pandemic if you're out of work or cannot work remotely. There also have been a lot of important changes, federal changes to unemployment that you should be aware of. So we'll just start talking about regular unemployment. What is it? Regular unemployment provides you weekly benefits of roughly 1/2 your weekly salary for up to 26 weeks if you lose your work for no fault of your own. You also get a $40 credit for each child you provide more than 50% of their support. And the definition of child also includes is children under 18 and disabled adults with no age limit. So right now, the reason to get unemployment, they're called qualifying reasons, have expanded tremendously due to COVID-19. So I'm just going to go through the list, okay? The first one is you were diagnosed with COVID-19 or you have symptoms. A member of your household was diagnosed with COVID-19. You're caring for a family member or household member who tested positive or was diagnosed with COVID-19. You have primary responsibility for a child whose school or childcare is closed and you need to care for them. You have primary responsibility for a member of your household who needs care. Your employer or a government order told you to self-quarantine. You've been advised by a healthcare provider to self-quarantine. Your immune system is compromised due to a serious health condition. You have a reasonable belief that because of COVID-19, going to work could harm your health. It's an important one to keep in mind. The head of your household died from the coronavirus, so now the whole household depends on you for support. Your place of work closed or reduced your hours because of COVID-19. Or you had to quit your job because you tested positive for COVID-19, or you came into contact with someone who tested positive. So as you can see, there's a lot of new qualifying reasons due to COVID. So there's some requirements. You must have earned at least 5,100 in the preceding 12 months. You must have valid work authorization and a valid social security number. That's very important. You should note, if you have work authorization and your card is expired, like in the case with many Tepecianos, TPS applicants, you may still be eligible if your work authorization was extended. It's strange though, because the card will say it's expired, but your work authorization may have been extended. So you need to check in on that. If you do not have a social security number or valid work authorization, do not apply. You should also note that unemployment benefits do not count as public charge for non-citizen applicants. So right now we're going to get into some of the recent changes under the CARES Act, which is a federal law that impacted unemployment in the states. So one of the first changes is the Pandemic Emergency Unemployment Compensation. What it does is it extends the benefits from 26 to 39 weeks. The second change adds more money. It's called the Federal Pandemic Unemployment Compensation Program. This is something Katie alluded to, the extra 600 you get. So everyone who gets state or federal UI will get an extra 600 per week for 16 weeks from March 29th to July 25th, 2020. And the third change is known as Pandemic Unemployment Assistance. What it does, it expands eligibility to those who would otherwise not qualify for unemployment, including, this is very important, this is for self-employed, gig workers, freelancers, and independent contractors. Think of people who have their own businesses, workers who drive for Uber, Lyft, some people who are looking for part-time employment, and kind of waives the full-time, looking for full-time work requirement of regular unemployment. You have insufficient work history to qualify for benefits. You have exhausted all your rights to regular or extended benefits under state or federal law or to the Pandemic Emergency Unemployment Compensation Insurance. You have been laid off from churches and religious institutions that are not eligible for benefits under state law. There are more, but we'll just keep going from there. And what's important, there have been a lot of issues with applying for unemployment right now. DUA is swamped. It's an old system that they have. When you add all these applications that are coming in, it's not a good recipe. So what I can tell you, if you have an issue, please contact your local legal services. So right now I'm going to jump into folks who are still working. These are essential workers and their rights. So obviously there's a lot of people who are making life possible for us. These are what are deemed essential workers. These are the folks working supermarkets, some folks still doing construction, people working in hospitals, etc. There are many laws that control the employment relationship, and I'm going to mention some of them that should be on your radar. Some of these include the laws controlling payment of wages, working safety, and other related laws. Most employers want to do the right thing, but there's always exceptions. So I'm just going to jump briefly into Massachusetts wage law. The minimum wage in Massachusetts is $12.75. The minimum wage increases every year by 60 cents until reaching $15 by 2023. So if you hear someone who's making less than $12.75, it's a big, big flag. Overtime. Employees in Massachusetts who work 40 or more hours are entitled to 1.5 times their regular rate for hours worked in excess of 40 hours per week. Please note that there are exceptions to overtime. So workers who work in restaurants, hotels, etc., aren't eligible for overtime. But I'm going to note a little later that under federal law they are, but I'll get into that. When workers need to be paid. Workers must be paid within 6 days of the end of a pay period. In other words, workers need to be paid every 2 weeks. It's illegal for employers to delay making payments, stating that things are slow, COVID-19, I'm not getting money, I can't pay you yet. That is illegal. So now I'm going to talk a little bit about Massachusetts sick leave. So Massachusetts currently requires that workers be provided up to 40 hours of sick leave per year. 1 hour of sick leave is accrued for every 30 hours worked. Workers may be forced to wait 90 days to use sick time, but they start accruing it immediately. If an employee has 11 or if an employer has 11 or more employees, the sick leave must be paid at the regular hourly rate. So if you're making 15 an hour, you take 7 hours of sick time, that's 7 hours paid at the 15-hour regular rate. So now we're going to jump into federal law. There's been a lot of changes and there's a lot of confusion around this. But we're going to jump back to traditional federal labor law. The minimum wage is $7.35 under federal law. Massachusetts uses a higher rate, so we go with $12.75. Federal law requires overtime payment. This is important. It's like a little area that gets a little confusing sometimes, but I want you guys to listen to this. So there are businesses in Massachusetts that are exempt from providing overtime, hotels and restaurants. However, if they're covered under the Fair Labor Standards Act, they must provide that overtime, even though the state doesn't require it. So let's say you're working 60 hours in a hotel in Massachusetts, the AG, the Fair Labor Division, can't go in and force that employer to pay you overtime, but the DOL can, the Department of Labor, that enforces the Fair Labor Standards Act. So that's important. So we're going to jump into leave. This is an unpaid benefit. This is the Family Medical Leave Act. It provides up to 12 weeks of unpaid job protected leave under certain circumstances. So right now we're just going to talk about the ones that are more pertinent to COVID-19. So if you have to care for your employees, for your spouse, child, or parent who has a serious health condition, or you have a serious health condition that makes it impossible or unable for you to perform the essential functions of your job. So COVID-19 would be a qualifying reason. So to qualify, you must work for a covered employee. What is a covered employer? A private employer with 50 or more employees in the preceding year. The employee has to have worked at least 12 months and has at least 1,250 hours within those 12 months. And the location where the employer works has at least 50 employees within 75 miles. Recall, this is unpaid, but this is job protection for up to 12 weeks. So it doesn't really provide much of a benefit other than the job protection. So now I'm going to jump into the new law. This is called the Families First Coronavirus Response Act. We call it FCRA, or FFCRA. The FFCRA is a new federal law that creates two paid benefits for workers. Remember the FMLA, unpaid. This is paid. The first benefit provides up to 80 hours of paid sick leave. The second provides up to 10 weeks of extended family leave. So the law took effect April 1st, 2020, and it expires at the end of this year, December 31st, 2020. So you can get sick leave, but the amount you get depends on the reason for leave. So you get up to 80 hours of paid sick leave at the employee's regular rate of pay, which is just their hourly rate, not including overtime, where the employee is unable to work because, first reason is, the employee is quarantined pursuant to a federal, state, or local government order or the advice of a healthcare provider. Or two, is experiencing COVID-19 symptoms and is seeking a medical diagnosis. So pay under sick leave is maxed out at $511 daily, or $5,110 overall for those 80 hours. So the other way you can get sick leave is up to is paid at 2/3 the employee's regular rate if you're unable to work because of a bona fide need to care for an individual subject to quarantine pursuant to federal, state, or local government order, or you have to care for a child under the age of 18 whose school or child care provider is closed or unavailable due to reasons related to COVID-19. Okay, so those are the reasons to use sick time. Additionally, you can use 10 weeks of family leave if and only if you've worked for the employee for at least 30 days and the employee is unavailable for this one reason. To work, you can't go to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID-19. Note, this is the only reason for the extended family leave, the 10 weeks. Okay, this is paid at 2/3 your regular weekly rate. But note, it's only 10 weeks, but you can get a total of 12. So start the first 2 weeks as sick leave, so for a total of 12 weeks. So what's important to note, the FFCRA applies to businesses with less than 500 employees. You can thank lobbying for that. Businesses with 50 or less employees may request a hardship exemption from the United States Department of Labor. We still don't know exactly what that's going to look like. This is important. Assuming the workplace is covered by the FFCRA, the employer must provide sick time and or family leave to all workers. All workers. This includes undocumented workers. There is no need to verify employment authorization to use FFCRA. This is a direct payment from the employer, just like wages, to the worker and bypasses the government. So the employer will then receive a dollar for dollar tax credit for FFCRA wages paid. It's also important to note this is a new right, completely independent from any other rights, aside from the FMLA. But it states that an employer can't force you to use your sick time or your vacation time before using FFCRA. It's completely at the choice of the worker. So right now I'm just going to jump real quickly to the National Labor Relations Act. This is important. Section 7 of the NLRA Guarantees employees the right to self-organize, to form, join, or assist labor organizations, to bargain collectively through representatives of their own choosing. And this is the most important part, and to engage in other concerted activities for the purpose of collective bargaining or other mutual aid or protection. So workers are allowed to work together to seek better working conditions. This includes their demands for a safer workplace, better wages, etc. And employers who interfere with, restrain, or coerce employees in the exercise of these rights in Section 7 are violating the law. These are known as unfair labor practices. So I'm going to go real quick through worker safety. So Occupational Safety and Health Administration, OSHA, is a federal Department of Labor agency that sets workplace health and safety standards. Currently, unfortunately, OSHA is only prioritizing regulation of healthcare facilities. OSHA has chosen not to regulate most workplaces during COVID-19, and rather than pass enforceable standard, OSHA is issuing guidance. So a complaint to OSHA for COVID-19 will likely not get you too far. A viable option would be to call your local board of health. They have the power to shut down employers, force cleanup, and change workplace practices. However, this is very important. The Baker administration has announced a 4-phase reopening plan. It starts with start, cautious, vigilant, new normal. This will start on Monday. So the governor announced that the reopening will be subject to mandatory workplace safety standards. These are mandatory, so there are consequences for violations. It includes social distancing, hygiene, staffing and operation protocols, and then cleaning and disinfecting protocols. All right, so right now we're not sure how this is going to play out, what enforcement will look like. So you just need to stay informed and stay tuned. And the news are a great place to learn from this. And that's pretty much all I can cover right now. Thank you so much.
Great. I think we're going to go back to Emily, who is going to talk a little bit about the public charge in general for us.
I just wanted to go back to public charge because I know that that is a big issue for our immigrant community, and we talked about a lot of things today, so I thought it would be helpful to do like a little quick recap on public charge and how these different areas are impacted. So we started with healthcare, and Katie was very clear in stating that any COVID-related testing and treatment will not be considered under public charge. So the health benefits that people are receiving related to COVID, they should feel very comfortable getting tested. They need to seek treatment, and none of that will be considered for public charge. And again, in Massachusetts, all residents of Massachusetts, regardless of immigration status, are eligible for some level of Masshealth if they're income eligible, and they will be covered through Masshealth for that type of treatment. Moving to SNAP. Individuals who are already receiving SNAP are likely in a category where they would not already be worried about public charge, and so they will receive more SNAP, but individuals who are not eligible for SNAP do not need to apply for SNAP now. Also, benefits that are being received by your eligible family members do not impact your immigration status, even if that card is in your name, because the eligible family members are minor children. Moving to Pandemic EBT, that has no impact on public charge. All children who are school-age children can be eligible for Pandemic EBT. Again, it doesn't matter whose name the card comes in. Those benefits are not ever considered for public charge, and all children, regardless of immigration status, are eligible for that. For housing, I'm going to skip. That's not a big public charge issue in the sense of folks who are in housing. That's a separate issue. But for unemployment, pandemic unemployment, leave, sick leave, paid leave, all of the rights that Pablo was talking about, none of those are impacted by public charge. Unemployment, either the new unemployment, the expansion of unemployment, or pandemic unemployment, those are all earned benefits. And so therefore, those are never considered under public charge previously. All the new expansions are also not considered under public charge. Also, it's just really important to remember that public charge only applies to individuals who are seeking immigration benefits through a family member. There are many, many immigrants who are not going to be subject to public charge ever because they are pursuing some type of immigration benefit where public charge is not a consideration. So for example, someone applying for asylum, someone applying for protection under the Violence Against Women's Act, someone applying for a U or T visa for being the victim of a crime or trafficking, unaccompanied minors who are applying for special immigrant juvenile status. There are many categories of individuals who are never going to have to deal with the public charge question. And we try to message this as much as possible, but I know that it's very confusing. So I really encourage folks to have their clients and families that they're working with seek out legal services, which Jill will talk about, if they have questions about whether public charge applies to them, because there are actually folks where they're never going to have to deal with public charge, and I would like them to know that so they can get the benefits that they're eligible for and get the help that they need. And so I also just want to touch really briefly on the economic stimulus package, so the one-time CARES package payment, just to say that it is very confusing for in the immigrant community. So the baseline is that if you don't have a social security number, you're not going to be eligible for that economic payment. And then if you are a mixed status family where some individuals may be paying taxes through ITIN, but only one individual has a social security number, or both parents are paying with ITINs and children have social security numbers, they may or may not be eligible. So only if there is an adult member of the household who has a social security number will you be eligible for economic stimulus. And then even in a mixed status family, you would have to file separately in order to be able to get the stimulus. But because of other deductions that might be available to you by filing together with your partner, it might not be worth it for that one-time payment. So there are low-income tax clinics that are available to advise people about whether or not they should be changing their tax filing status in order to get that. But the bottom line is, if adults in the household don't have social security numbers, they're not going to be eligible as a household. So even if your family has 5 U.S. citizen children and you've been filing your taxes for 10 years under ITINs, unfortunately, you're not going to benefit from that stimulus package. There are some state and federal bills that are looking to extend the stimulus to ITIN filers. For folks who don't know, those are individual tax identification numbers that people can apply for even if they don't have social security numbers to pay taxes. But those bills are in preliminary stages, and you know, we're hoping they'll move forward, but we don't really know. So that's just a little quick recap on public charge, and wanted to touch on the economic stimulus. But now I think Katie will introduce Jill, who will go over a bunch of wonderful resources that are available to answer all the rest of your questions, hopefully.
Great, thanks again, Emily. So yes, now we're going to turn to Jill O'Brien, who is an AmeriCorps legal advocate at the Justice Center of Southeast Massachusetts, who's going to leave us with some great resources going forward.
Awesome, thanks. Hi guys. So I'm going to try and keep it brief because I'm seeing some really awesome questions in the chat box, and I want to, you know, give everyone some time to answer those questions. But I'm going to share my screen and just kind of go through some resources that we found, especially the multilingual resources, because we know language access is really important. So this will be sent out. Hopefully you all can see my screen. This large document will be sent out after, and it basically has links to everything that was mentioned in the presentation, as well as just some additional links with some great multilingual resources and some really good sort of one-pagers. But I'll go through some of the more important ones really quickly now. So Mass Legal Help is a great place to start. I know a ton of information was given out today. So if there's something we talked about today that was confusing or a little bit more dense, this is a great place to come and get some more information. So if you wanted, let's say, some more housing information, you can go to the housing portion, and there's videos and sort of a Q&A. If you wanted more information on the stimulus check, more like specifically, there's, you know, a link for that as well. So there are a lot of options here just to get some more detail. Another great, hold on, website, here we go, is the Legal Resource Finder. So Emily had briefly mentioned this. If you have a client or a student who is having a legal issue, this is a great place to find free legal aid or cheaper legal aid. So all you have to do is you type in your zip code. So I'll type in mine, number of people in your household, I'll say 3, monthly income, I'll say 1,000. And then you click on the legal issue. So I'm gonna click immigration.
Jill,
It'll ask.
Jill, we're not seeing your screen. We're seeing just
Oh no, okay. That's unfortunate. Well, it says it's sharing. 1 second. Can you see it now? Good, okay. So this is the Legal Resource Finder. So like I said, all you have to do is type in your zip code, the number of people in the household, monthly income. You can click whatever issue it is that you need assistance with. And also this is available in English, Spanish, and Portuguese, which is very nice. It'll ask you for a more specific problem. So I'll say I'm having trouble with work authorization. it'll search for you and it'll come back with some legal services providers. And obviously nobody's really offering walk-in intakes right now, but a lot of legal services providers are offering over the phone intakes. And there is language capacity on the majority of those phone lines. So this is just a really great resource if someone is looking for legal services. So moving on, can we still see my screen? Are we good so far? Okay. We are gonna go to Project Bread. So this was also mentioned as a really great resource for anything really related to food. So I've actually called their hotline just to kind of see what information they can provide, and they cover a ton of different topics. So they can help with PEBT, they can help with SNAP, they can help with finding food banks, and they also have this really handy meal site map on their website, and I'll send out the individual link for this. And you can essentially search your address and it'll tell you which sites are near your house and what sort of meals they're offering and what the stipulations for those are. We do know that a lot of our clients don't necessarily have access to the internet. So if that's the case, I would just highly recommend calling the hotline. They're super helpful and they have great language capacity on the hotline. And then we had also talked about how a lot of immigrants are not going to be eligible for the stimulus check or any sort of benefits. And if that's the case, there is a large document here that does have language capacity with a bunch of emergency relief funds. A lot of them here have specific what the industry or eligibility is, but a lot of the eligibility requirements are pretty lax. They're just regional or anybody can apply. These funds aren't always available. A lot of them do depend on donations, but from the people we've talked to that are running these funds, they're kind of just taking donations on an ongoing rolling basis. So we'd highly recommend you advise people to just go ahead and apply. They might not get funds immediately, but as funds become available, I know they're really trying to get those out to people. So I don't want to take up too much time going through the rest of these resources. There's a ton of great multilingual options here. But if anybody is looking for something specific that you're unable to find, please feel free to reach out to me and I can help you find it.
Great. So I think we now are going to move into asking some of the questions that we've been getting in the chat and that we got beforehand. Just really early on, we got a question about LPRs, green card holders, and whether they need to be worried about traveling or being allowed back into the country if they leave the US. I think the executive order did exactly what it was designed to do, which was confuse people. So if anybody has an answer.
I'm happy to take a stab at that. So in terms of green card holders, they should be able to travel and come back to the US. That doesn't mean that they might not be subject to some sort of additional enhanced screening for health safety reasons, and or that their state might not have some quarantining requirements based on their travel. But as green card holders, they should be allowed back into the country even if they travel outside the country. That being said, we always caution green card holders on travel, because if you have other issues that are not COVID related, such as criminal-based issues that have arisen since you've previously were granted your green card, then you do need to consult with your attorney before traveling, because traveling and returning could trigger some immigration issues that you were not previously aware of.
There were a couple questions that came in probably for Katie about Pandemic Ebt. And those were, do you need a PIN for a PEBT card? And is PEBT retroactive to when schools were closed?
So the PEBT card, it functions the same as an EBT card. That's where some people get confused and they think it's just like SNAP. So that card will come with the same use of the other EBT cards. So I believe there is a PIN still associated with it. And then I'm sorry, what was the second question?
Is PEBT retroactive to when schools closed?
So yes, if a family was receiving SNAP or meals through the National School Lunch Program, then it will be retroactive to the day that schools closed. I believe it was like a 35-day. There was a time period in between. But if it's a family that's just now applying to now get the PEBT benefit that wasn't receiving it before, it will not go retroactive back to before the family applied.
Okay, Pablo, can you remind us, everybody, where to call for more sort of general workers' rights questions again?
I would just refer initially to the Worker Center contacts that I provided to Rochelle. I don't know if we passed those out, but that's definitely a place to start. But if you're having a specific issue with minimum wage, stuff like that, always go to the Fair Labor Division. And if it's a federal law, I would, like FMLA, FFCRA, contact the Department of Labor Wage and Hour Division, and I can get you those contacts if we don't have those.
A lot of that information will be in the resource guide at the end. The Worker Centers list will definitely be included.
Great. And another question coming your way, Pablo. Can people report violations by employers anonymously? And if so, how?
So OSHA does allow what's called a whistleblower complaint. So you can do those anonymously. But like I mentioned, OSHA is not really enforcing too much during COVID for non-hospital sort of work. So I don't know how far that'll get you right now. I think what we need to look forward to is Charlie Baker's new standards that are going to come out. Those are actually enforceable. So just keep an eye out for those.
Great. Does anybody have tips? Anybody in this group has had this conversation before, but tips about combating the fear that many undocumented families have about reaching out to these organizations for help, or what do you try to say in those situations?
I guess which organizations are you talking about? Because my answer would be different depending on which organization it is, because some organizations pose more or less risk to immigrants, and some pose no risk. I think it's really just the way that I try to do it is just inform my clients and patients as much as I can about their rights. I can't make a decision for them. I can never guarantee, honestly, that things are going to be 100% safe and fine. As a lawyer, you really can't do that. But I really can kind of give them the most information to know what their rights are, so they can make the most informed decision that they can when interacting with these different agents.
Pablo, oh, I'm sorry. Another.
No, that's okay. I was just going to say that, you know, we also know that a lot of our Massachusetts agencies and our local agencies are really allies to our immigrant communities. And so, you know, we're very fortunate in that way. We've never had any reported issues with any of our state agencies. You know, they're already under sort of strict privacy laws, but we also have never heard of sort of rogue issues happening in our agencies. We're very lucky that we have great allies. And so I certainly think that, of course, ultimately people have to make the decisions for themselves, but I feel like I spend a lot of time talking to clients about the fact about public charge not being as broad as people think it is. That was absolutely the goal of the administration, is to make every immigrant believe that they should not get any assistance from anyone. And public charge is not nearly as broad as the community thinks it is. So I encourage everyone to get sort of this individual consultation, if they're able to, about what their situation is. And there are a lot of really great resources that are multilingual about public charge and sort of what exactly the scope is and who it really applies to. So I do think people need to be encouraged to seek help when they need it and that they're eligible for. They have to make the decisions themselves, but I do think that absolutely the administration wants everyone to think that they shouldn't get any help, and that's not what the public charge rule says.
Did anybody else want to field that question, or should we move on to the next one? So there was a question about whether undocumented immigrants are eligible for the FFCRA.
The answer is yes. Yes, yes, yes.
And to sort of piggyback on that, there's also a question about whether temporary workers are covered by the FFCRA.
Yeah, temporary workers are covered. Well, it also depends on whether their employer is covered. I think I saw the issue in the questions earlier, whether, so if someone worked for a staffing agency and they're placed at a host company, who pays? In that circumstance, if let's just say the staffing agency is over 500 employees, so they're exempt. So is there another way to get those benefits? So you got to look to the to the host company, the client, to determine if they're what's called a joint employer under the Fair Labor Standards Act. And that's kind of a case-by-case sort of analysis. You got to look to who keeps the employee's records, who supervises the worker, all that sort of stuff. And if they are deemed a joint employer, they should be providing those benefits, provided they're under 500 workers.
Question generally about immigration timelines. Emily, I don't know if you can speak to this, but what are realistic timelines for cases going forward?
Slow. The realistic timeline is slow. Everything in immigration for folks who have been practicing in this era, and especially for folks who have practiced previous to this era, is that yes, immigration is still processing things, but the timeline for everything is just longer than it used to be. And COVID has not helped that. That being said, we're still getting cases processed. We're still getting notifications. So I don't know that it's been a significant slowdown from the already general slowdown in this administration. Unfortunately, every immigration case has a different timeline. And those can actually be seen online at the uscis.gov website. There's a tool there that explains what the processing times are for each type of application. Obviously, those are estimates. Folks are also welcome to call the USCIS customer service line, which does have services in Spanish and English. They don't have any other languages, unfortunately, in order to get updates on their individual cases. But there's no way to blanket sort of say what the processing times are for cases, other than to say slow.
Okay, so another question that we've gotten is, what can individuals do about a landlord that is harassing them to pay their rent or threatening to kick them out in spite of the moratorium?
I would say that I think mostly people need to be informed about what their rights are, which is that they cannot be evicted simply because their landlord tells them that they want to be evicted. And if something happens like a lockout where the landlord tries to change the locks or something like that, they absolutely can still get an emergency court hearing by phone in order to have them get access back to their housing. I know that happened with one of my colleagues. And so, you know, I think people just need to be informed of what their rights are, and certainly they can reach out to legal services offices who all have housing attorneys to get more information. And if it's a opposing party, a landlord that's a known entity, possibly legal services can intervene and try to talk to them about it. But I think the most important thing is for individuals to be informed about their right to not be evicted. And again, there has to be a court process in order for someone to be evicted from their housing, and there are no court processes going forward unless there's criminal activity or endangering of public safety.
And I would piggyback off that, also potentially report it to the AG's office, because they are keeping a list or a note of who, you know, what landlords are doing and what landlords' attorneys are filing cases still, because they're keeping track of kind of the bad actors in this scenario.
Just a general question for whoever might want to field it. Any tips for non-primary English-speaking families that are trying to access either benefit lines or services online that are mainly in English?
So I can speak to DTA and Masshealth. So for individuals who are looking to do Masshealth applications, Healthcare for All has a phenomenal hotline and a lot of language capacity to help individuals complete these applications over the phone. For DTA, there's language access rights. DTA can't just tell you, oh, you speak Spanish, I don't speak Spanish, so we can't have this appointment today. You have a right to receive services in your language, and they can use phone interpreters. So a lot of these agencies do have the ability to use phone interpreters to communicate with individuals where English isn't their primary language.
There are also some language services available depending. For example, the DTA, the unemployment department rolled out a Spanish mobile app for the application. So they're working on building language capacity in those areas.
Okay. Pablo, could you maybe remind everybody again of unemployment and PUA eligibility for folks that don't have work authorization or whose work authorization cards have expired?
So, sure. So if you don't have work authorization, you can't apply for unemployment benefits. But what's happening is that a lot of workers have expired work authorizations, like the card itself is expired, like the date you look at it, it says expired, but it might have been automatically renewed. So you got to check to see if that's been the case, and you can check with USIS to determine the status of your work authorization. But just because it's expired doesn't mean you're not eligible for unemployment, so you got to check.
I think we've answered the majority of questions that have come in. Some have been a little bit specific to individual cases, which we don't have time to go in today, unfortunately. But I would encourage anyone who has outstanding questions to reach out to anybody on the panel or to follow up on those resources that Jill mentioned and that are posted in the chat. But we can take a few more minutes if anyone has anything else you want to send through. Looking pretty quiet. So someone asked about a copy of the recording. Yes, we will be posting this through the Mass Legal Services website. But thank you all so much for your time. Thank you to all of our presenters for your efforts. It's really lovely to have you today.